Hello, I'm Joy, and I'm going to be telling you today about obtaining and confirming for blood consent. Any patient who is receiving a blood product, whether that be red blood cells, platelets, fresh frozen plasma, or the cryoprecipitate, requires that a consent be signed. Informed consent means that the patient is able to understand the information that's being given to them, ask questions, and have those questions answered. A physician is the only one who can get an consent for blood products from a patient. So you want to make sure that the physician has already gone in and done this, that the paperwork has been signed. When you go in to speak to the patient, ask them if the doctor has been in and if they have informed them that they are getting blood and that they did consent to this. Ask them again if they have any questions. Many patients, when they have even the possibility of having to need blood, will be signing consent even though they don't need it at that moment. Patients that may be going into surgery, patients who have certain disease processes. So it may not be at that moment that they're getting it, but you want to make sure that when the time comes, it is there, and that you've answered all their questions. There are risks and benefits, and the patient deserves to know what those risks are, including allergic reaction, hemolytic reaction, infection, and they need to know the benefit. You have to have the clotting factors so that you don't bleed out. You have to have red blood cells so that you can carry oxygen throughout your body. But the patient at all times does have the right to refuse. There are other options if they are nervous and don't want to have blood from another person. In some cases, if it's something prior, like a surgery coming up, they can actually have their own blood drawn and stored and used on them. In some cases during surgery, they can actually recirculate the blood and filter it through and give the patient's own blood back to them during the surgery. But the consent has to be done by the doctor. The consent must be signed before the nurse can go on with the procedure of giving them blood. When the nurse starts the procedure, is getting ready to start the procedure of giving them blood, you need to inform the patient that it can take up to 4 hours to do this, and to notify the nurse if they're having any issues. Are they having any shortness of breath, itching, back pain, fever, chills? These are things to speak up and let the nurse know. The nurse is going to be in that room setting up that blood and starting that blood, and then for 15 minutes following and getting another set of vitals. During that time, the nurse is going to be watching for any of these reactions. A reaction can happen up until 4 hours later, but most allergic reactions happen within the first 15 minutes. So make sure someone else is watching over your other patients. This one has your full attention for the next 15 minutes. Thank you for your time. Always make sure your consent is done. Always ask your patient. Make sure you've answered all their questions. Have a great night. Thank you.